Greetings. I'm Congresswoman Stacey Plaskett, and I represent the Virgin Islands here in the United States Congress. Thank you for inviting me to be the keynote speaker for your Caribbean American Heritage Month program. I would like to thank the Honorable Sylvia Hines Radix, Chair, the Honorable Dina Douglas, Betty Matanda John, Mistresses of Ceremonies Kings County Courts, and the Caribbean American Heritage Month Committee. The coronavirus disease, COVID-19 crisis, presents human, social, and economic challenges in the Caribbean. The advent of COVID-19, unfortunate as it is, has highlighted the need for close medical cooperation between states and the Caribbean. Medical cooperation is the key to fight against the COVID-19 pandemic. In recent years, there has been a growing awareness of emergent outbreaks of tropical diseases in the Caribbean. It was hoped that the lessons learned during these pandemics would have served as an impetus for a revised approach in the strategic planning for the management of infectious diseases in the Caribbean. As the coronavirus rapidly spread across the Caribbean, at-risk countries had to prepare for adequate hospital capacity, with competing priorities and smaller populations relative to most developed countries. It has been challenging to plan for intensive care units, ICUs, to cater to pandemics. Indeed, increased ICU capacity requires increased infrastructural and human resources, fully trained staff, and equipment. Furthermore, COVID-19 has impacted all social strata, affecting industry, manufacturing, tourism, labor, and education. From metropolitan cities to small villages, large numbers of people have had to isolate themselves. The Caribbean region has been hit particularly hard by the pandemic. The pandemic has touched education, healthcare, as well as the foundation of economies of the island nations. Additionally, there are important lessons from COVID-19 that we have seen. The pandemic has peeled away and made very plain the issues surrounding the need to build capacity on multiple levels in the Caribbean, for the increased scope of disaster management as well as training and teaching, prevention planning. With the increased prevalence of chronic non-communicable diseases and increased mortality rates in patients with underlying health issues, one of the areas which require additional resources is in the need in the Caribbean for robust primary healthcare programs, which cater to the unique challenges of the Caribbean countries. The first COVID-19 case in the Caribbean was confirmed at the beginning of March 2020. As the coronavirus spread rapidly across the Caribbean, at-risk countries needed to prepare for adequate hospital capacity. However, the virus has now spread all over the area, though with limited fatalities, in all likelihood due to the prompt closure of their frontiers, both land and sea, as well as varying degrees of lockdowns and curfews, realizing that denying entry to carriers would reduce community spread. The long-term deployment of healthcare measures for tackling the virus include additional ICU staff, acquisition of beds, equipment, ventilators, catheters, etc., pose significant challenges for small countries faced with competing for budgetary constraints along with sources and supplies, unlike most developed countries. Increased ICU capacity requires increased structural and human resources, fully trained staff, and equipment. It is a major challenge for ICUs to plan for pandemics. Consultation of expert clinical advisors and access to additional funding to achieve these goals are extremely important. The region continues to rely on receiving assistance and consultancy expertise from traditional historic alliances, which may not be always forthcoming, particularly as those areas fight the pandemic in their own jurisdictions. During the COVID-19 crisis, the measures taken to contain and slow the spread of the virus, such as border closures and lockdowns, have had severe adverse effects on those economies. individual governments has had to strike a balance between implementing these measures and preventing the collapse of their economies in the face of healthcare systems and social safety nets stretched beyond capacity. In the Caribbean, fragile healthcare systems could face collapse. The tourism sector, the primary economic engine, is at a standstill. Social safety nets are virtually non existent, especially for people in the informal economy. Thus, governments will be under pressure to give higher priority to relaunching economic activity than to a collective strategic planning approach to the provisions of healthcare on a regional basis. An impact scenario showed that the slump in tourism caused an 8% fall in total gross domestic product growth in the Caribbean. While we continue to eradicate the pandemic, we have an opportunity for the region to define a Caribbean approach to this and future such events. The immediate priority should be to secure financing for the acquisition of equipment for initial responses, personal protective equipment for frontline staff, testing kits, diagnostic equipment, drug treatments, vaccine, and importantly, tracing and tracking software. The logistics of distribution need to be defined for both air and sea delivery. The Organization of Eastern Caribbean States, OECS, already maintains a successful pharmaceutical procurement program, which could no doubt be expanded to include member states of the wider Caribbean community in CARICOM. COVID-19 pandemic has demonstrated the value of medical cooperation on a worldwide basis. In this context, the Caribbean Medical Doctors Association, CDA, played a major role in sharing the epidemiological spread of the COVID-19 pandemic in the region, experience exchange, and capacity building in individual territories. CDA was created in 2000 in Miami, Florida, by a group of doctors from various countries. It's a non-governmental, independent, nonprofit organization. Its objective is to share clinical experiences not just within the region, but with colleagues in the United States of America, Europe, and Africa. The group has so far attracted 250 medical professionals using social media to host webinars. The group believes that increased use of technology needs to be explored to facilitate closer medical cooperation for the healthcare delivery as we enter into a new world of pandemics and closed frontiers. Technology will also play a major role in capacity building, training, teaching, human resource development referred to above. The COVID-19 pandemic has presented yet another opportunity for Caribbean healthcare policymakers to engage in multilateral cooperation, thereby building robust healthcare systems. CARICOM, the Pan American Health Organization, the Caribbean Public Health Agency, and the Organization of Eastern Caribbean States work together to contain and manage the epidemic. This allowed equipment transfers by friendly governments for expansion of ICU capacity in the sense of ventilators and beds. In addition, OECS and CDA helped in the coordination of routine medical referrals or emergency medevac from neighboring islands to Martinique or Guadeloupe. Indeed, prior to the pandemic, regional organizations may have focused mainly on policy positions. The pandemic led to a practical involvement in capacity building and patients medevac to referral centers. The Caribbean region, being heavily dependent on tourism, has suffered economically, but has fared better than others in health impact of the pandemic. With the exception of the Dominican Republic, which receives the largest number of foreign visitors, the islands were able to forestall the importation of the virus by early closure of their frontiers, thus minimizing community spread. The Caribbean region must ensure that the development of their native human resource and accompanying healthcare infrastructure is prioritized to guarantee self-reliance on an ongoing basis, as well as during pandemics. The COVID-19 illustrates the need for solidarity and enhancement of building of healthcare capacity through cooperation between governments, the CARICOM, the PAHO, the CARPHA, the OECS, and CDA. These interface between disease, politics, non-governmental organizations was the key to face the COVID-19 pandemic and a means to strengthen the healthcare systems in the Caribbean. Finally, I am proud that the United States has heard the requests of Congressional Caribbean leaderships members, including myself, Congresswoman Yvette Clarke of Brooklyn, Chairman Greg Meeks of Queens, and others, to introduce a competent global vaccination plan to support our neighbors of the Caribbean area. The Biden administration, through the State Department and the COVID response team, is committed to bringing the same urgency to international vaccination efforts that we have demonstrated right here at home. The first step was to give an allocation of approximately 6 million doses to the Caribbean and Latin America, which was a poignant step in the right direction that will dramatically stem the tide of COVID's deadly progression in the region. More recently, the White House has announced it will share 41 million U.S. vaccines through COVAX, with 14 million of those allocated to Latin America and the Caribbean. These vaccines are being shared to save lives and to lead the world in bringing an end to the pandemic with the power of our example and with our values. And we will continue to follow the science and to work in close cooperation with our democratic partners to coordinate a multilateral effort. Strong American leadership is essential to ending the pandemic and to strengthening global health security for tomorrow to better prevent, detect, and respond to the next threats. I and other members have argued that America's support of the Caribbean, our third border, with these vaccines is essential to our diplomatic efforts in the region. The COVID-19 pandemic has demonstrated unequivocally the value of multilateralism. It has revealed an urgent need to expand capacity for human resources and healthcare infrastructure at the national level, indeed at the international level. This two-pronged approach may be the only effective method to ensure the sustainability of improved healthcare and to save lives during the pandemic, particularly in an area like the Caribbean region. Thank you. Enjoy the rest of Caribbean American Heritage Month, and thank you for allowing me to speak to you today.